Okay, so we have here the different anaerobes, the different species of our anaerobes. Okay, we divide our different species of our anaerobes as number one. Okay, so based on their gram staining results, so we could have here the gram-positive bacilli, which is spore-forming. This includes all the species of our Clostridium. Then we have also the anaerobes, which is gram-positive bacilli, which is non-spore former. This includes here your actinomyces, your Propionibacterium, your Bifidobacterium, and we have your Lactobacillus. On the other hand, the gram-negative na anaerobes, which are your bacilli, but most likely they are Coccobacilli. Okay, that includes our Bacteroides, your Prevotella, and we have also your Porphyromonas. Another one is your Fusobacterium. Then we have also here the cocci, na gram-positive, that includes your Peptococcus, and we have also your Peptostreptococcus. And the anaerobes, which is cocci, na gram-negative, we have here your Velionella. So we started the discussion with the different individual species here with our spore-forming gram-positive bacilli. It includes here your Clostridium species. Okay, so as to the spores, we can classify that one as to the location. So pwede siyang terminal, nasa terminal end, subterminal, so bago mag-terminal, and we have also here the central, pag nasa gitna ang spores. So first one, we have your Clostridium perfringens. The Clostridium perfringens try to produce here, try to cause here three main infections. One is the food poisoning. So pag food poisoning, you get infected by ingestion of contaminated food with the preformed toxin ng ating Clostridium perfringens. So there are two types of that na pinaka-common. We have your type A na food poisoning. So that one is being caused here by our enterotoxin. Pag sinabing enterotoxin, to say that one is the gastrointestinal tract manifestation. So if that one is enterotoxin, expect that one to cause here diarrhea or gastroenteritis na disease, or that's manifested by our diarrhea, vomiting, ganun. Okay, so your type A na food poisoning was considered that one as mild and self-limited na food poisoning. The type C, on the other hand, is caused here by the toxin B or the beta toxin. Okay, that's your, wait lang, that's your beta toxin. Okay, that's your beta toxin. You call this one as your necrotizing enterocolitis or your enteritis necroticans. The type C is much severe compared to your type A. That one would have your bloody diarrhea, and of course we have here the vomiting. Another one caused here by your Clostridium perfringens, we have also here the bacteremia. So it can cause here infection in the bloodstream. Another one is your wound infection or the skin infection in the form of your myonecrosis, your gas gangrene. So this one try to cause an infection with our skin, basically by allowing the spores or the preformed toxin to enter the skin through your cut or abrasion in the skin. So therefore, pumasok sa skin natin. Okay, your gas gangrene is basically caused here by the alpha toxin. You call that one as your lecitinase or phospholipase D, which this one try to cause here a deeper tissue penetration, deeper tissue damage, and that result here to your necrosis. Myonecrosis, sobrang mas labing necrosis, so nabubulok ang skin ni patient natin. Okay, so most likely, your Clostridium perfringens, the vegetative na spores, will be destroyed by the heating process, pero ang kanyang endospore, okay, hindi siya madidestroy. Remember that nagiging toxin production lang ito pag ang vegetative spore natin will be converted to your, your endospore is being converted to your vegetative spore and try to cause the infection manifestation. Okay, the gram stain result for the Clostridium perfringens, again, this one is gram-positive bacilli, large boxcar cell. Okay, that would have here your, pwede siyang gram variable din. Usually, ito nagiging gram variable sila pag old na ang specimen or culture natin. Okay, that one would have your gram variable, straight rods with blunt ends, and most likely the spores we found here in the subterminal area. Okay, then we have here the colony characteristics of our Clostridium perfringens. Number one, that one is capable of your double zone of hemolysis. So, dalawang zone. One zone here, the inner, the outer, is usually that one's caused here by the alpha toxin. And that one produces here partial hemolysis, and that would have a wider zone of hemolysis. The inner naman is caused here by the beta toxin, and that one would have a narrow zone of hemolysis, but that one is a complete hemolysis caused here by the beta toxin. Another one, your Clostridium perfringens also give a positive result for the lecitinase but negative result in the lipase with your egg yolk agar, culture media. Okay, lecitinase positive natin would be the presence of the opaque zone surrounding the colony, and lipase natin ang sheen or iridescent, but then again, your Clostridium perfringens, it will give a negative result in the lipase, but it will give a positive result with your lecitinase. Nagler reaction is just your agglutination reaction for identification of the alpha toxin. Again, the alpha toxin responsible for the gas gangrene, di ba? For you to identify that one, so all you need to do here is to streak with your egg yolk agar. Okay, so you have that. Your agent for that is your alpha antitoxin because you wanted to identify your alpha toxin. So, gagawin mo dito, okay, divide your culture media into half. Okay, streak here alpha toxin. So, alpha toxin came from an organism na may alpha antitoxin. So, streak mo dito ang ating alpha antitoxin. Then, after that one, streak mo dito ang ating sample that contains Clostridium perfringens. Basically, most likely because we are identifying Clostridium perfringens, so streak your organism here throughout. I-streak mo dito sa lahat. Okay? From this area na may alpha antitoxin at the area na walang alpha antitoxin. Because again, that test will identify if the organism produces an alpha toxin. Then after that one, you try to incubate at 35 degrees Celsius for 24 to 48 hours and try to observe here for the result. Again, if your sample contains an alpha toxin, it will neutralize your alpha antitoxin streak on this area. And therefore, pag nag-neutralize niya, so mawawala, walang growth na because again, na-neutralize niya. In this area naman, since wala itong alpha-1 and alpha antitoxin, so dito mag-grow ang ating sample, your Clostridium perfringens, because again, wala ka ditong alpha-1 antitoxin. Another one, Clostridium perfringens, also capable of the stormy fermentation, identified primarily in your milk medium. So, inoculate mo lang ang organism natin doon, ang Clostridium perfringens would produce here bubble formation, signifying that it tried to ferment your milk. So, we have also here the reverse CAMS test. Again, in the traditional na CAM test, we are streaking for your Staph aureus, diba, against your Strep pyogenes. Ito naman reverse because instead of using your Staph aureus, you streak here your Strep pyogenes. Original is your Staph aureus saka Strep agalactiae pala. And dito naman sa reverse CAMS test, instead of the Staph aureus, ang streak mo doon ay your Strep agalactiae against your Clostridium perfringens. Okay, it will produce here an arrowhead zone of hemolysis. It's reversed because instead of the Staph aureus na ginamit sa usual na CAMS test natin, gumamit ka dito ng Strep agalactiae. Okay, that will also still produce here your arrowhead zone of hemolysis. Okay, the next species of your Clostridium, we have your Clostridium tetani, the causative agent of our tetanus. Okay, so its main variance factor is the neurotoxin in the form of your tetanus plasmin. It's a neurotoxin, so it tries to affect your nerve impulses. Because it tries to inhibit the release of your neurotransmitter responsible for our muscle contraction or nerve impulse transmission. Ganun. So because of that, it results here to your spastic paralysis characterized here by continued spasm in our nerves or in your muscles, basically. Because again, wala tayong neurotransmitter because this toxin try to inhibit the release of that. So, it would have here the following manifestation of your tetanus. trismus or your lockjaw. So, hindi mo magalaw dito na part because dito most likely ang nagiging nagkakaroon ng paralysis. Rhizus sardonicus or distorted grin or sardotic smile. Ganun. Difficulty in breathing is another one. Okay, gram stain result would resemble also here the same as with your almost the same with the morphology ng Clostridium perfringens. So gram variables, straight rods with blunt ends, only that the spores is found here on the terminal end, not on the subterminal, as seen in your Clostridium perfringens. Colony, this would have capable the swarming motility just like our Proteus, but this one is able to grow in a very slow growing swarming motility. And then this one is also would have your narrow zone of your beta hemolytic reactions with your SBA, sheep blood agar. Okay, the next one we have here your Clostridium botulinum. So let's try to cause here botulism. So basically this one produces also neurotoxin in the form of your Botox toxin or your botulinum toxin. So being a neurotoxin, it tries to inhibit the release of your neurotransmitter acetylcholine. And that results here to your flaccid paralysis. Okay, so that one would be the Botox. Marang medical importance ang ating Botox. So ginagamit siya for the treatment of your wandering eye or your strabismus or even for the pampabatak ng mukha, diba? So that's your for the frown lines. For the frown lines. Okay, we have here the diseases associated with your botulinum. So, it try to cause here mga food poisoning. So, we have here the foodborne botulism caused here by ingestion of the preformed toxin contaminated food. Infant botulism, most likely that one is by ingestion of the spores in the honey. And we have also here the wound botulism that hand. So, aside from food poisoning, it can also try to cause here wound infection. So, it would enter your wound here through your cut or breaks in your skin and therefore try to cause here wound botulism. So, the main manifestation of your botulism, we have here weakness, flaccid paralysis, but also have the slurred speech or even impaired nerve vision. Morphology, so under the gram stain, your botulinum would also have here in the gram variable. This one would have a straight rods with the blunt ends. And most likely, this one would have a characteristic na tennis racket appearance with the subterminal na spores. Okay, colony, this one is beta hemolytic. And then the neurotoxin could be identified not only in the fecal sample because this one is the food poisoning. Aside from that one, you could also recover the neurotoxin in the feces of the patient or even aside from the feces, aside from that, you could also recover that one from your serum, vomitus, and even your gastric contents. On the next one, Clostridium difficile. So there are two toxins produced by this Clostridium na species. First, we have your enterotoxin, which is the toxin A. Again, your enterotoxin try to cause here your gastroenteritis or diarrhea. The second one, the toxin B, that one try to cause here your cytotoxin. It's try to cause necrosis. Try to cause here necrosis in our mucosal tissue or colonic tissues. Okay, so this is associated with your difficile would be your drug-induced na pseudomembranous colitis. What do you mean by drug-induced here? So basically, this one is being formed here if the patient is taking antibiotic drug. Pag nagtitake siya ng antibiotic, it try to kill your other bacteria in your intestinal tract, leaving only your Clostridium difficile without competition. So, mag-isa na lang siya and therefore try to cause here your pseudomembranous colitis. That's drug-induced. Okay, morphology of the deficient one would have your thin na rod shape or bacilli with your gram stain result. Its spores could be found in the subterminal end. Okay, the colony morphology. So this one would have your horse manure odor, barnyard odor, and also capable chartreuse fluorescence. The selective media for identification of your Clostridium difficile would be your cycloserine, cefoxitin, fructose agar that will appear to be yellow with a ground glass appearance on that. Okay, so we have also your confirmation that toxin produced by difficile is by Okay, the fecal sample, then perform the tissue culture. Okay, for identification of the toxin B. Again, toxin B is responsible for the myonecrosis, for the necrosis. Okay, that's a type of your cytotoxin. Okay, then we have also here the Clostridium septicum. Okay, Clostridium septicum is the causative agent of our neutropenic enterocolitis among patients with a cancer related to your colorectal cancer. Okay, that one would have your morphology, just like our difficile, that one would have your thin rods, but the spores would have be found in the subterminal den. Okay, the colony of that would resemble here the medusa head, just like our Bacillus anthracis. This also would have here the swarming motility, just like our tetany, and it also have your beta hemolytic reactions. So again, we have here the summary of all our Clostridium na species. The swarming motility that would appear with your tetany and even with your Clostridium septicum. Okay, double zone of hemolysis here would identify your Clostridium perfringens, your Chartreus fluorescens with the yellow, and a colony with a CCF8, that's your difficile. The citidinase test will only be your Clostridium perfringens. Lipase, I think all of them here are all negative. Okay, for the spore locations, so all of them would have here the subterminal spores except your tetany that could be found here on the terminal end. Okay, the next group of your anaerobes are your gram-positive bacilli, which are non-spore former. The first one, we have your actinomycetes israelii. So, being actinomycetes, so para siyang branching na mga nocardia na gram-positive bacilli natin, just like the nocardia na group. Okay, actinomyces israelii produces a granulomatous infection which has the sinus tract formation which eventually try to drain pus, magbe-break open ang skin and try to produce here your yellow-orange na pus or granules that would resemble here your sulfur granules. Morphology, so again, it would resemble our nocardia, so it will have your branch na filamentous form the bacilli. And for the colony, just like also our nocardia, so it would have here para siyang okay, rough na colony. Okay, so the young colony usually appears to be a spider web or spider-like woolly, but the old colony would resemble here the molar tooth na appearance. Okay, the next species here, we have your Propionibacterium acnes. So this one, again, this one is a normal in primarily found here in our skin. Tama ba? So, the end product of the metabolic pathway produced by by the Propionibacterium acnes would be the propionic acid. Okay, so the disease, again, is trying to cause a severe inflammatory action in the acne. Okay, and that one also try to cause severe bacteremia and even your endocarditis. And being found in the skin, so therefore, this is the most common cause of the as a contaminants in our blood culture. Okay, morphology, it appears to be pleomorphic, so iba-ibang shape. It also appears to be like our diphtheroids. For the colony, this is positive for the catalase and even positive for your indole. And the colony here, so it might range from small na colorless white na colony to your large. Pero pag larger colony, may color siya. Yellowish tan na color. Pero pag smaller colony, it appears to be walang color. Colorless or white. Okay, that's your Propionibacterium acnes. Okay, the next species of your gram-positive bacilli here na non-spore former, we have your Bifidobacterium. The Bifidobacterium would have your Coccobacilli, also range to become long-chain branch. And the terminal end part of the bacilli niya would have here different characteristics. It could be bent, it could be pointed, it could also be bifurcated, it could also be club-shaped, it could also be your fork tail or your dog bones appearance. Okay, usually they appears in single, in chains, in a V arrangement, in palisade, or even star-like arrangement. Okay, for the disease, try to cause mixed infection found in our abdomen, pelvis, or genitourinary tract. Okay, the colony of this one would have your small, cream white, convex, shining with irregular edge. Okay, the last one, the gram-positive bacilli natin na non-performing, we have your lactobacillus. The lactobacillus is your gram-negative. Okay, this is your gram-positive na bacilli. Okay, that would be responsible here for maintaining the normal vaginal pH at less than 4.5. So, it try to maintain the normal vaginal pH by the production of the lactic acid from your glycogen, and therefore preventing also here the bacterial vaginosis. Okay, bacterial vaginosis, again, as a review, is just an increase in the production of your mobiloncus, prevotella, and even your Gardnerella vaginalis, and decrease production ng ating lactobacillus. Okay, as a summary of our colony characteristics of each of your species of your gram-positive bacilli nonce-performer. Okay, so 48 hours incubation would have a colony of less than 1 millimeter. Sobrang liit niya. That's for the Actinomyces israelii. So also produces here branching form, would have the raft na colony just like our nocardias, what I have mentioned. Bifidobacterium would have here, ito yung mga, okay, that would includes ang ating mga fork tail, mga ganon. Dog bones. Okay, your catalase in indole positive is only for your Propionibacterium acnes. And molar tooth for the old colony characteristics would only be found here with your Actinomyces israelii. Okay, now we go to your gram-negative, anaerobic gram-negative bacilli. So, this most likely they are cocobacilli. This includes your Bacteroides, Prevotella, Porphyromonas, and Fusobacterium. The first one we have, before that one, we have here the virulence factors associated with the infection caused here by our gram-negative cocobacilli anaerobes. So, they are having the capsule. Again, that would try to resist the phagocytosis or to prevent the phagocytosis. Another one, there are also contains here the adherence factor that will allow them to bind to the host tissues. Okay, the first one, we have your Bacteroides fragilis. Okay, so before the classification of your Bacteroides is that they are bile tolerant, and the other one, we have here the bile sensitive. So pag sinabing bile tolerant, so basically they are not, they try to tolerate the presence of the bile and therefore they're able to grow. So this is refers to your Bacteroides fragilis. On the other hand, your Prevotella and Porphyromonas, they are considered to be bile sensitive. So mean to say, pag na-presence ng bile, they will not grow. Okay, so your Bacteroides fragilis would have your colony characteristics of the colony here producing a black colony which is more than 1 millimeter. So medyo malaki ito. And that one would have also here na black na colony characteristics. Okay, so there are two na main culture media that would help us then to distinguish the growth of your different gram-negative anaerobic na mga cocobacilli. The first one, we have your BBE, which is your Bacteroides bile esculin. So that one contains 20% na bile, also contains the esculin. This culture media will allows you to determine if your bacteria are able to tolerate the presence of 20% na bile and try to hydrolyze your esculin. So from the word itself, Bacteroides by esculin, so this is very specific for your Bacteroides lang. And therefore, in the BBE, okay, your Bacteroides fragilis would be identified here as able to grow in this one and try to produce also your black na colony. Another one, we have your kanamycin, vancomycin, lake blood agar. Your kanamycin, vancomycin, lake blood agar contains 3 antibiotics. Your vancomycin, your kanamycin, and we have also your colistin. Based on that reaction, okay, your Bacteroides fragilis here are all resistant with our vancomycin, with our kanamycin, with our colistin, and therefore it will grow in your kanamycin, vancomycin, lake blood agar because that one is resistant to all the antibiotics incorporated in your kanamycin, vancomycin, lake blood agar. This is also saccharolytic. Pag sinabing saccharolytic, it try to ferment try to digest your carbohydrates. Paano natin malalaman kung nag-grow siya sa ating kanamycin, the vancomycin lake blood agar? Ang titingnan nyo palagi would be your vancomycin. Kung resistant ang result niya sa vancomycin, so mag-grow siya sa kanamycin, vancomycin, lake blood agar. Pero pag susceptible ang result niya sa vancomycin, expect that one that it will not grow. Yung kanamycin, vancomycin, lake blood agar. Okay, then next, we have here your Prevotella and even your Porphyromonas. Okay, both of them produces here brick red, okay, na fluorescence with the UV light. Both of them also try to produce black na pigment. Okay, so ang pinagkaiba nilang dalawa, okay, sa BBE natin, your bacteroids by screen agar. So this one will not grow on that one because again, remember that your BBE agar is only for your bacteroids. Kanamycin, vancomycin, lake blood agar. Okay, anong result niya dito? With your vancomycin resistant, kanamycin resistant, colistin is variable. Ulit, para malaman natin pag mag-grow hindi sa kanamycin, vancomycin, lake blood agar, titignan natin ang result ni vancomycin. Here, resistant. Ang kanyang result, therefore, your Prevotella were able to grow in your kanamycin, vancomycin, lake blood agar. Another one is the saccharolytic. It try to hydrolyze your carbohydrates. How about your Porphyromonas? Again, this one will not also grow in your BBE, but in your kanamycin, vancomycin, lake blood agar. Okay, so vancomycin, susceptible ang result niya. So from here, okay, it will not grow because it's susceptible dito sa vancomycin. Kanamycin is resistant and we have also colistin. We also have here the resistant result. Okay, and therefore it will not grow in your kanamycin, vancomycin, lake blood agar. At the same time, this one will not grow also in your Bacteroides by esculin agar. Okay, this one is also, again, pareho sila nito. They are producing brick red na fluorescence with the UV light. Both of them produces also na black na pigment. Only that your Prevotella is saccharolytic. This one is asaccharolytic. And your Prevotella grow in kanamycin, vancomycin, lake blood agar. This one will not grow in your kanamycin, vancomycin, lake blood agar. Okay, now we go to the Fusobacterium. So there are three species of the Fusobacterium. One is your Fusobacterium nucleatum, Fusobacterium mortiferum, and we have also Fusobacterium necrophorum. So we have that all were able to grow in your kanamycin, vancomycin, lake blood agar because they have a resistant result with the vancomycin except your nucleatum, hindi siya mag-grow. Another one, all, we try to produce here chartreuse fluorescence and indole positive except your mortiferum. And the only lipase positive is only with your necrophorum. So we have here your Fusobacterium nucleatum. This one would have here the spindle shape, fusiform. One end is tapered, the other one is pointed. Okay, this one would have also here breadcrumbs colony characteristics, just like our nocardia. Ground glass appearance. It tried to become green upon exposure to the air of the culture media. It would have also the chartreuse fluorescence with internal flickering because of the crystalline internal structure. Okay, we have here the summary, okay, of our gram-negative coccobacilli na anaerobes. So we have here the vancomycin, kanamycin, colistin. Okay, so again, your Bacteriophagilis would have your resistant lahat. Prevotella would have resistant with your kanamycin, vancomycin, and variable result with your colistin. Porphyromonas, okay, susceptible siya dito. Therefore, hindi siya mag-grow sa ating kanamycin, vancomycin, lake blood agar, resistant. Fusobacterium, resistant siya sa kanamycin, vancomycin, except your nucleatum. Again, your nucleatum will not grow in our kanamycin, vancomycin, lake blood agar. Okay, the BBE is for the Bacteroides. It also try to hydrolyze or esculin, producing a black na colony. Ang kanamycin, vancomycin, lake blood agar, positive natin Bacteroides because again resistant dito. Prevotella resistant dito sa vancomycin. Another one is Fusobacterium resistant dito. Again, except it's Fusobacterium natin except with your nucleatum. Okay, the brick red na fluorescence would be present with your Prevotella and your Porphyromonas. Chartreuse fluorescence would be with the Fusobacterium except your Fusobacterium mortiferum. Your iridescent sheen is for the lipase. Again, that will give a positive result for the Fusobacterium, specifically Fusobacterium necrophorum lang. Ang ating nucleatum, ang ating mortiferum, will give a negative result with your lipase test. It will only give a positive result with your Fusobacterium necrophorum.